Hi, I'm Dr. Ramchandra, cardiologist from Sri Sri Holistic Hospital at Nizampet in Hyderabad. Why are heart attacks always sudden? I told you these cholesterol blocks happen over decades together. So when the plaque produces a lot of pressure on this lining called the endothelium and it cracks, the blood comes in contact with the cholesterol material of the plaque. And like you know, the tendency of the blood is to clot so that we don't bleed to death whenever there's a small injury. So when there's a crack in this blood vessel on the inner lining of this tube supplying blood to the heart, the blood clots. And this sudden clot blocks the tube totally. And when the supply, like we discussed, there are just 3 tubes supplying 3 areas of the heart muscle. And when one of these tubes is blocked totally, it manifests as a heart attack. Now, the heart attack pain is very similar to an anginal pain. It is central, radiates to the left hand, the inner side of the left hand, to the jaws. But unlike an anginal pain, it does not happen when you're exercising, but it could happen whenever you have a heart attack, which means you could just be talking like this and it can hit you. You could just be sitting, you could be walking, whatever it is, the pain suddenly starts. And it's usually quite severe. People describe it as the worst pain they've ever had in their life. It's also associated with things like sweating, vomiting, giddiness, and some people might fall down also. And the very characteristic thing about it is it does not stop when you rest. Unlike an anginal pain which stops or goes away when you rest, this pain continues. And if it continues for more than half an hour, it's very classical of a heart attack.